How's everyone doing? Good to see you. Dr. Delal, we didn't talk about or run a show. Do you want me to start? Do you want you to start, or what's your preference here?
You can kick it off, then I'll go from there.
Okay.
I think Gage has a run of show.
That sounds great. He probably shared it with me, and I didn't read my email. Sorry about that.
Gage, you let us know if we're off.
So far, so good, guys.
Thanks so much to everyone for joining. This is something that Dr. Delal and the team have worked hard to arrange for quite some time. And I just wanted to start off by talking about drug overdoses and the epidemic that we're experiencing. The numbers of unintentional drug overdose deaths were high last year, and this year is looking to be an even more challenging year, as many of you know. COVID-19 has certainly exacerbated that situation for a variety of different reasons. People are facing very challenging economic and mental health issues, but on top of that, it's been more challenging for people to seek services because of the issues around COVID-19. And it's looking like the numbers this year will be higher than last year as far as unintentional drug overdose deaths. The vast majority of those overdose deaths are involving an opioid, and most of the opioid-related deaths involve some sort of synthetic opioid. This is a deep, deep challenge that is being experienced by every city around the nation, and New Haven is no different. I think what makes New Haven special is the way that we approach these problems. We treat substance use disorder as a health issue. We do not criminalize it. The city of New Haven gets this, and Vital Strategies and the partnership we're announcing today gets this. And our partners that are working on the front lines in the community certainly get this. And that understanding is the foundation of this work and will lead to our success in addressing it. It's not only the compassionate way to approach this challenge, but it is also the way that the data says will lead us to that kind of success. I think as more and more people have their own personal experience, either with themselves or a loved one with substance use disorder, more and more people are understanding that addressing this as a health issue and focusing on harm reduction is critical. Today, we're announcing a partnership with Vital Strategies and welcoming to our team Christine Rodriguez, who we will hear from in just a moment, to help with the work, not just with Dr. Delal's team, but with the Harm Reduction Task Force in addressing the overdose epidemic. So grateful, Christine, to you for helping us and joining our team, and very grateful that we have the leadership of Dr. Delal and so many members of our community and nonprofits that are collaborating to address this very, very important issue.
Thanks, Mayor. I don't know if Gage, if you want to facilitate the runner show, but I'm happy to jump in because I think I'm next. Thanks, Mayor. I appreciate your eloquent comments as always. I think that kind of distills exactly what we're trying to do with this partnership. So, from my side, I'm really enthusiastic about this partnership with Vital Strategies. I've appreciated the many conversations with the Vital Strategies staff, including Deanna King, who you'll also hear from later over the course of the last few months as we tried to contend with how would we launch something like this in the context of the pandemic. And, I really appreciate the flexibility and the ability to adjust. Getting to this point, to the point where we have Christine Rodriguez, someone who has a lot of experience in the harm reduction field, providing leadership to New Haven. I think it's a really good partnership. In addition to that, people may not know a lot about Vital Strategies, and I'll let the Vital Strategies folks talk about that. But they're really a globally renowned public health organization. So what they put out carries a lot of weight, and it's really great that their resources are going to be brought to bear to really help the residents of New Haven. I think that's really just a fantastic opportunity for us. Importantly, I think this partnership will help facilitate, how New Haven can innovate and tackle big challenges when we work together. we're announcing the launch of the Harm Reduction Task Force today, but we've already had a number of meetings and partnerships already where we have well over 40 at some, individuals from various organizations signed up to be part of this task force. So there's a lot of energy already out there. So in this sense, we're accelerating the work, but we're not, necessarily building out some new infrastructure here. We're coordinating and building on existing services and resources. I'll call out specifically from the health department, our data overdose to action grant. That's a collaboration with the New Haven Health Department and the Quinnipiac Valley Health Department. It gets funding through the CDC via our State Department of Public Health, as well as organizations that are represented on this press conference. SWAN has been doing work here for a number of years, so thank Beatrice for being here. The Yale Community Healthcare Van, represented by Dr. Altice, again, has been doing work in New Haven for decades. So, I really see this as a way to build on existing knowledge and assets that we have in New Haven. A couple of specifics of what, where I see this going in terms of the Harm Reduction Task Force. In terms of strategies, this will allow us really to help, use data, and we're working on a data system that will be very actionable to solve unique problems that are unique and idiosyncratic to New Haven and target services to those areas that we know that need them. And some of that work has already been ongoing. It will help us facilitate the adoption of evidence-based practices in addressing and preventing overdoses in New Haven. And it will also help us test and innovate new ideas and approaches that work best for New Haven. And before I turn it over, I just do want to share a couple of thoughts, just taking a step back and maybe just providing a definition of why we're calling this the Harm Reduction Task Force and calling this whole initiative harm reduction and not necessarily just overdose prevention, as some folks may not be familiar with that terminology. So the experts define harm reduction as a set of practical strategies that are aimed at reducing the negative consequences of drug use. But importantly for me, embedded within that definition is a set of values that I want to call out, which I think Mayor Elicker alluded to in his comments. But I think it's really important that we elevate these values and principles. First is that we need to recognize that people who use drugs have been and will always be a part of our community. And condemning and ignoring the problem there, or kind of saying that it's an issue, it's a problem, it's not going to make it go away. Secondly, it's important to, quote unquote, meet people where they're at. What that means is understanding that drug use is a continuum, and it spans anything from abstinence all the way to severe use of substances. So we have to target our intervention to knowing where people are at the time. And we also need to recognize that overdose is sort of a signal to the problem. It's not necessarily the problem itself. There's a long and often complicated journey that leads up to overdoses. And ultimately what this does is it comes down to treating people who use drugs with dignity, fairness, and respect in the way that we'd want to be treated personally if we had issues or if our family members were affected. So with that, I'll turn it over to the next speaker. And Gage, I'll look to you and to identify who that is. I don't have the runner show.
Next, we'll hear from Deanna and then Christine from Vital Strategies.
Thank you, Gage. Good morning, everyone. First, I just want to start by thanking Mayor Elicker and his administration for including us in this press conference and being such passionate and thoughtful collaborative partners. Dr. Law just explained harm reduction in a way that was more empathetic and intensive than I've seen a lot of government partners do. So I'm really grateful for that understanding of this work. I want to briefly touch on the work of Vital Strategies Overdose Prevention Program. So Vital Strategies is the lead implementation partner of the Bloomberg Philanthropies initiative to combat the overdose epidemic. Our team provides both technical and financial support to our partners working in both government and community-based organizations. The program was established in 2018 to tackle the epidemic in the United States. And to date, the Overdose Prevention Program is bringing a comprehensive approach to reduce overdose deaths in Connecticut, Michigan, New Jersey, and Pennsylvania, where fatalities are the highest in the country. Since beginning our work in New Haven, we have formed partnerships with SWAN, as well as Yale's Community Healthcare Van. These collaborations have borne innovative projects, and we were able to provide technical support to harm reduction providers who are working at the crossroads of a pandemic and an overdose epidemic. We are excited to continue our work with Dr. Dalal and the staff at CSA, who have proven to be open-minded and very receptive partners. We chose Connecticut because they've been very open to harm reduction as a strategy to address overdose deaths. And they were one of the first states to offer legal protections to syringe exchange participants. The former New Haven mayor, John C. Daniels, once said that needle exchanges may not work, but when you have a serious problem, you try to find serious solutions. So Connecticut's acceptance of harm reduction has created this really fertile ground for continued innovation. And at this moment where COVID-19 has bred challenges that need serious solutions, the city of New Haven has been up to the task. Christine will share more about what's happening with the Harm Reduction Task Force. We're really excited to have her on our team. We began working with Christine even prior to this position. She was taking the lead on creating a COVID-19 guidance for people who use drugs in the beginning of the lockdown. So that was really necessary. So we're really grateful to have her expertise, her compassion and understanding in this project. So I believe she's next. I'll pass it to Gage.
Yep, Christine, you're up next.
Thank you. Thank you so much for the kind words, Dr. Dalal and Mayor Elicker, and to press representatives for attending. I so appreciate it. It's a real pleasure to be here with the dedicated folks with the Community Services Administration and also harm reduction service providers around the city. I have been working in and around harm reduction for about 14 years across Maryland, California, Washington, D.C., and I am incredibly humbled and really honored to have been welcomed so warmly in New Haven. Regarding the task force, I am super enthusiastic about its potential. I'm really excited about the work and the clear commitment of its members. People who use drugs have been experiencing a really devastating and a steadily worsening crisis in overdose for many years. And as mentioned, prevention is more challenging than ever now under COVID. As Deanna mentioned, this spring I worked to co-create a toolkit of resources for providers regarding harm reduction and COVID with vital strategy support, of course. And I'll be looking for opportunities to similarly support organizations across New Haven. With the task force specifically, I'll be advising and supporting the work to build partnerships, align efforts and resources, implement best practices and promising innovations, and really work with the city of New Haven to enhance harm reduction services and ultimately reduce, and of course, ideally eliminate preventable overdose mortality. So I really look forward to being a part of bringing this to fruition, of bringing to fruition the collective impact I know is possible to improve the quality of life of our friends and neighbors who use drugs. And I'm happy to answer any questions, but I'd love to kick it over to our community partners to hear about their work. Thank you.
Yep, so next we'll hear from our community partners. We've got Beatrice at Swan and then Rick at the Yale Community Healthcare event.
Hi, I'd like to start off by saying how excited Swan is to partner with you, Mayor Elicker in the city, and Dr. Dalal, Deanna, and Christine from Vital Strategies in this critical program to prevent opioid overdoses. That the city recognizes this, it means a lot to people who are living and using, and who are seeing friends dying, family dying, and this is a way we can help prevent that. And I'd really, I'm very grateful. And so Swan is started in 2016 as a harm reduction organization after there was stings, prostitution sting. I can go on and on about Strong, but basically, Swan, we hand out condoms, we do syringe exchange, fentanyl test strips we give out, and Narcan. And I think working with this is going to help us reach more people. We are very grateful that Vital Strategies recognize us as a harm reduction and through their generosity, we were able to get us a van that can now go to different parts of the city and hand out more and more harm reduction tools. I just want to give you some numbers that we've done. Okay, so far we've given out 5,000 fentanyl test strips so people can make an informed decision. You know, they can test their opioid and make an informed decision if they find it is laced with fentanyl, if they want to do it all, if they want to do it just some, but at least they know that fentanyl's in there. We've given out 8,000 naloxone kits over the years. And SWAN staff members have been responsible for 50 overdose reversals. And there's probably a lot more that we don't know of, that other people that we handed out the naloxone to. We've handed out 390,000, these are ballpark figures, 390,000 new syringes, and we've taken back 196,000 use syringes. And now with the van, like I said, we can go to different parts of the cities, and we've on like Saturdays, our collection day. Each Saturday we collect at least 2,000 used syringes. But this is really exciting. I'm very grateful to the city and of course Vital Strategies. And that's about all I want to say right now, because I know there's going to be questions and we want to hear from Dr. Altice. Thank you.
So thank you so much for allowing me to say a few words. And I came to New Haven 35 years ago, and to sort of quote the Grateful Dead, what a long, strange journey it's been. And I've had the good fortune to work with every mayor since 1986 with regard to harm reduction. For some of you who may not recall the history, the first syringe services program in the country was in New Haven and in Boston. John Parker led that effort, and he was a friend, and he was part of the fabric that moved us towards the first syringe exchange program. And the community healthcare van sort of was an original response to that. We opened up in 1993. We sort of decided that, at that time, these epidemics have really sort of evolved and changed. And one of the nice things about Vital Strategies coming together with the city of New Haven is that, first of all, I think New Haven is really one of the crown jewels with regard to sort of dealing with evolving epidemics. It was the HIV prevention back in 1989 when the first pilot research study happened, and the New Haven Health Department took this up as sort of an original challenge. And it has evolved, and it's now the opioid epidemic and overdoses that have sort of come to the forefront. Vital Strategies is so perfectly poised to partner to really make this, a sort of a crown jewel of harm reduction and community responsiveness. It takes a village, it takes SWAN, and it takes all of the other members that Dr. Dalal has put together to sort of bring this together, whether it's the emergency departments, it's the emergency responses, it's overdose prevention, it's the work that Beatrice just spoke about with regard to getting naloxone into the hands of everyone that needs it. The community healthcare van is a slightly different model. It is a harm reduction, but it sort of marries health and prevention along with harm reduction. We've already handed out over 800,000 syringes. This year, we have started, even in the midst of COVID, almost 100 patients on pre-exposure prophylaxis. We still have to prevent HIV. We've started over 150 patients on medications for opioid use disorder, which is one of the most effective ways to do this. And we've done this in the midst of COVID by doing it all remotely. We've not seen any of these people in person. We've done it by using apps, by using telehealth and all kinds of other things. We've treated 35 newly diagnosed patients with hepatitis C, and we've been able to do this through very important partnerships throughout the city. And it's the Rainbow Coalition of people coming together. And I can't think of a better or more important time to bring all of these services together. And Mayor Elicker, I can't tell you how grateful I am that you are sitting at the pinnacle of this in order to make all of this happen. And you've empowered all of the people to come together to sort of keep New Haven really at the center and strong force in moving things forward.
Thanks, Dr. Altice. I appreciate that, and more importantly, appreciate the work that you and Beatrice and others are doing in the community. And it's been everything from distributing harm reduction kits to the work that we all did together on the drop-in center this summer, to many other ongoing projects that are being planned. And your support giving input on the crisis response team that we're working to develop. I noticed that Director Bond's on the call, so not to put you on the spot, Director Bond, but before we open up to questions, do you have anything you'd like to share?
Yes, thank you, Mayor. And it's just really humbling to be on this presser today, just to be able to hear about this initiative that's being led by Dr. Delisle's office. And of course, we are grateful to be partnering, but just to hear about the commitment that's happening on the community level. As you know, the city of New Haven is one of the top 5 cities being impacted and having the highest case fatalities of opioid overdoses. And so to be able to know that every resource that's possible coming together and to ensure that we are streamlining our efforts is really commendable, and shows that it really does take an entire village to be able to fight this epidemic. As you know, it is declared as a public health crisis, and our health department has been working closely with Dr. Delisle in ensuring that we continue to monitor and do surveillance, and we're working closely on developing a dashboard, and are also having a dedicated outreach worker that will be working closely with CSA to be able to collaborate and provide the education at the ground level and be able to get the messaging out and work together on being able to reach the community at large. And so it's been such a pleasure to transition. I know most of my role has been with the pandemic, but I think the mayor provided a great point where he indicated that it's been exacerbated coupled with this pandemic. And so we want to make sure that we keep moving, treading forward with our initiatives, and want to thank Dr. Delisle and Vital Strategies and all of our community partners on this press conference today for all of your leadership and support.
Thanks, Director Bond. Let's open it up to questions. Go ahead, Mary. You're on mute.
All right, sorry. Put the whole thing in perspective. How bad is the situation right now in New Haven? And you know, I've known that there has been a lot of efforts over the years with exactly what you went through. So why are things, if they are, maybe it's incorrect to say it's out of control, if all those assets were already in the city, maybe you can explain that and how you're going to make it better besides coordinating.
Dr. Law, do you want to take that, or who should take that?
Yeah, I don't have the numbers in front of me in terms of you know, kind of the most recent numbers. I think we're anticipating, we can look that up and get that to you, because we get those reports on a regular basis from the state health department. But in any case, you know, in terms of answering the second part of your question is, you know, if all these resources are here, you know, what besides coordinating can this bring to the table? So I can answer that in a couple of ways. I think, you know, coordinating, I think, you know, in a straight sense, just, you know, kind of implies that we'll just figure out who's doing what and then plug the pieces into what the needs are. But I think this initiative really goes beyond that. It's beyond coordination. It's really kind of a brain trust and brainstorming and a quick way to get from an idea to an action that can only happen when you have you know, this core group of organizations and individuals that have the energy to say, yeah, I want to take this on. This is a new initiative. We got to take a lot of steps to get there, but I can do this piece of it. So I think, you know, it's coordinating is probably just, you know, one of the aspects of this initiative. It's really more about momentum and building a collective sense of energy that allows us to do more and more innovative things.
And if I could just add to that, one of the things that happened oops, just to add to this, is that when the groups come together, there's something that's called collaborative learning that happens, where you learn what all of the other stakeholders have, bringing in new ideas, generating. That's one of the things that Vital Strategies has done, is they have this sort of very broad perspective. So innovating with new ideas, having new people sort of adapt and change their service delivery in order to be more responsive to the epidemic. And I think that that's what's happened by that coordination piece. It's more than just coordination. It's really about collaborative learning, and so that people can modify and adapt and implement differently and more effectively.
I can also add to that and speak to the value of collaborative learning. One of the things that we realized was a priority when the pandemic began, and we realized that we needed to shelter in place, was to advise our harm reduction providers on how to allocate services and maintain services when shelter in place ordinances were in effect. There was not a lot of information at the time about how people who use drugs will be impacted by the lockdown. And I think when you're seeing an increase in overdose numbers, like that's very much attached to what we're all experiencing with the pandemic. So Christine joined us in the beginning. We had several calls with not only our providers in New Haven, but also our providers in Pennsylvania, Michigan, in New Jersey, just to talk about what they were doing and figure out ways to improve services and maintain services, and sort of develop new strategies based on what was happening really quickly, and something that we had no sort of prior knowledge of. So that coordination was definitely urgent and necessary, and immediately beneficial once it became better, more apparent of what we were dealing with.
Mary, I think our team can give you more detailed numbers, but if you look at the Department of Public Health's website, every month except for August this year, there were more overdoses than in previous years. And so clearly there's a significant problem that I think is just a trend overall in recent years, but it's been exacerbated by COVID.
Thank you.
Yeah, I was going to say that I have a map that's also broken down by county. But for the month of November, we had about 60 substance-related events per the EMS report that we had, and about 25% of those were overdoses. As the mayor indicated, there is a graph that's available in maps that are available broken down by county. So on a county base, we're seeing about 31.46 per 100,000.
Thanks,
Right,
Director
thank
Baum. I saw that Paul had his hand up.
Good afternoon, everyone.
Hey.
I have a really kind of basic question. It might be a dumb question. So we've written a lot about the great work that the community health fan's been doing in recent weeks, and Swan, we went out to Dixwell Plaza. What's the news today? I'm really unclear. Have you hired Ms. Christine to be a city employee funded by Vital Strategies to coordinate the work that's going on? Or have you named a new task force? I don't know if it's going to be another secret task force, if we'll know who the members are. What is the news? I mean, we have a new employee paid by somebody. We have a new task force. We may or may not learn the composition of. What's the news?
Dr. Dalal, do you want to?
Sure. I mean, that's what the news is we're announcing our partnership with Vital Strategies. That was kind of the lead up for today's conference. Part of that includes the onboarding of Christine Rodriguez, who is paid for by Vital Strategies but seconded to the city of New Haven. So she's working full time for the city of New Haven, with her primary role being coordinating the task force activities, as well as providing subject matter expertise, and overall, strategic direction to where we go. The harm reduction task force is an open membership. If you're interested, you ping Christine and she'll put you on the list. And it meets, the holidays are a little bit funky in terms of when it's meeting, but the next meeting is Friday, December 4th. And then starting in 21, we anticipate it'll meet on the 4th. I forget if it's the 3rd or 4th Fridays of every month. Christine, you can correct me on the exact scheduling that we anticipate.
So thanks for that. So onboarding means onboarding means Christine is a city employee now working for the city, but her salary's paid for by Vital Strategy. And
No, she's a Vital
partnership means
Strategies.
Vital
She's a Vital
Strategy is going to
Strategies
participate.
employee. She's a Vital Strategies employee, detailed to the city of New Haven.
Full-time New Haven detail, like working out of City Hall or virtually out of City Hall.
Virtually at this point.
Yeah, but so welcome, Christine Rodriguez. I guess you're New Haven person now, and there's a new task force. Okay, and then that chart you showed, is that Justin? Is that New Haven County, or state?
That's Connecticut. I just happened to pull it up before the press conference to
Gotcha.
get a better understanding overall of the situation across the state. And it's on there's a number of documents on the state DPH's website.
Because you had said New Haven is running higher than last year. I just wondering if there is any number of what last year was in New Haven and any number of what New Haven is this year.
I think the short answer is yes, but I don't have the numbers in front of me.
Thanks.
Any other questions? Go ahead, Mary.
So Gage just flashed a connection, a link on the screen, so maybe he can just send it to the two of us. Easier.
Sure.
And any statistics that Director Bond has, and pass those on.
Absolutely.
Mary, linked you in an email with Dr. DeLaw and Director Bond, and I'll shoot you this link too with Paul.
Thanks.
All right. Well, thanks everybody. Welcome aboard, Christine, and we'll see you all soon. Take care.